this is Ellie.
Hey, sweetheart.
Ellie's been retching for like 24 hours.
Okay.
And Mum's extremely worried about her.
On the Gold Coast, unwell little rescue cat Ellie has been brought in to Alex.
Hello, sweetheart. You're a beautiful girl.
Ellie's owner Shirley is a keen sewer, and when her precious Ellie started suddenly dry retching, she instantly became alarmed that the curious cat may have swallowed a needle or thread.
Has she ever done anything like this before?
No, she hasn't. No.
She's been pretty healthy up to now?
She could have snuck in there and got a bit of cotton, maybe.
Okay.
I thought, oh, she'd be right in the morning, but no, she was doing it all during the night.
So we've got to find out.
It's just not like her.
Yeah. We'll take really good care of Ellie. I'll let you know as soon as we find anything.
Okay, that's great.
Okay?
Thanks a lot.
What I'm worried about with Ellie, she may have swallowed a bit of thread or needle and it's now got stuck. And if it is something like that, we need to find out pretty quickly. Okay, let's have you out and we'll check you over. I know you're a bit worried. Okay.
Ellie is agitated, which is making it tricky for Alex to do a full examination.
Come on, sweetheart. Are you all right?
I can tell that she's quite nervous, so we're going to need to go really slowly with this little girl.
Oh, can I have a look?
Oh, good girl. Okay, well, I can't see anything obvious there. Feel around her neck. So when she's retching, you know, she could be trying to bring something up.
Or maybe it's just stuck in the back of her tongue.
Yeah. Listen to her chest as well. Hey, Ellie, good girl. Good girl. Cats do not like being in hospital as a rule. It's noisy, there's dogs barking, and it just makes them very uncomfortable. I think she's getting the limit of what she's going to put up with, hey?
Yeah.
She's getting a little bit stressed out, so I'm going to give her some sedation, and then we'll pop her in a bed and let her settle down for a bit. This will just relax you a little bit.
If Ellie has swallowed a needle, Alex needs to find it quickly, but she'll have to wait until the scared little cat is more relaxed.
Good girl. There you go. Good girl.
In Sydney, Kate's on a rescue mission.
I'm going to see Axel, the 8-month-old boxer who is driving his parents absolutely mad.
Jess and Jerome live in a ground floor apartment with their 4 kids and a very boisterous and noisy boxer called Axel.
Knock, knock.
Hello, Dr. Kate.
How are you?
Good, come on in.
Hi, beautiful boy.
Down.
Hello.
Good boy.
Come on. Oh, he's looking beautiful, you guys.
Oh, we love him.
Do you love cuddles? You do love cuddles.
I have known Axel his whole 8-month life, and he is absolutely beautiful. But he is driving Jess and Jerome absolutely up the wall. So you guys have called me for a very specific reason.
Yes, barking. Barking when we don't pay him any attention.
Okay.
As soon as we talk to each other or we watch TV and we don't pay him the attention, then barking. Down, Axel. He's our first dog that's ever graduated from puppy school, so we were really proud of that. But after that, it's like, how do you train your dog to make sure that they don't do things that are annoying, like barking? We live in an apartment block, so we have to be mindful of everyone else, and we hate for him to bark.
Yes, that's something that is going to cause these neighbours to complain.
Down, Axel.
May even result in them having to rehome or actually get rid of Axel. And what happens when you ignore him? Because I presume that you've tried that.
It just gets worse.
Okay.
We end up either taking him out for a walk or giving in to him and giving him something.
All 4 of my children know he's my favourite child. We just love him, but we have to do something. We just need to stop it.
He is like a 2-year-old child.
Exactly.
He is like, everyone pay attention to me at all times. It's out of control. They can't continue as they are. We have to figure out a solution for them.
Down, Axel. Down, baby.
In Sydney, Audrey is on her way to check on Minnie, a very special companion cat.
Hi, Charlize. How are you?
Hello, I'm well.
Hello, Minnie.
She's all ready.
Here she is. Thanks for popping her in the carrier.
That's okay.
So Charlize is the main carer for the owner, Andrew. and he's quite sick. He's got MS. There you are. This cat means the world to him, so she's called us in to have a look.
She just lays on his bed and keeps him company.
You're his main companion, aren't you?
Yeah. Minnie's a beautiful stray. She just wandered in and jumped on his bed, and they got along like a house on fire, and they do things together. She's such a beautiful cat, and she's so affectionate.
She is, isn't she? And he'd love her very much.
Oh, he does. He had a dog, and that died around 8 years ago. And he went downhill quite fast. He was really depressed. And then when she came along 4 years ago, he started picking up and being jovial and laughing and joking. And
power of animals, huh?
Yeah.
All right, Miss Minnie, let's have a look. Oh, that does look pretty nasty. It's quite big.
It is. It's gotten bigger in the last few months.
Yes.
And we thought maybe she had been in a fight and been scratched, and it had been infected and never really healed.
I see Minnie for the first time, and I'm quite shocked with how that looked. It looks more than just a wound. It actually looks like a mass that's ulcerated, so a lot more serious than I thought. What I'm concerned about is that it's growing quite quickly,
Yes,
especially the last couple of months, and that it's looking quite red and raw, so it does look aggressive or quite fast growing. So it could be a malignant tumour that we need to get off quite quickly.
Charlize fears the worst if 16-year-old Minnie's tumour is beyond treatment.
If Minnie goes, then Andrew goes downhill. He doesn't want to get disappointed again or lose another animal.
From here, I'm going to take Minnie into our partner hospital.
Oh, darling.
We'll go ahead, take the lump off. The best case scenario is that there's no signs of internal spread, that we've got it early enough. We'll look after her. Worst case scenario is we won't be able to operate, and eventually Minnie will probably die.
I love you, darling. It's all right.
Down.
In Sydney, Kate's answering a distress call from the owners of a dog that never stops barking.
Down, Axel.
I'm going to get you guys on the couch. I'm going to get you pretend to watch TV like you would at night. And I'm going to sneak around the corner and see what he actually does.
Okay.
Kate wants to see for herself Axel's behaviour when he's not the centre of attention.
Axel, down. Axel, down. Down, baby. No. Axel, no.
This is out of control. They live in an apartment building. They can't have this continue on.
Why are you barking?
It's not a good boy. Not a good boy. You get all the attention. My biggest fear that we have to get rid of him, and that's just not an option. It's like saying get rid of one of your kids. Axel.
It doesn't take Kate long to work out why Axel is so needy.
Yes. No.
He's relying on you guys to entertain him, and he doesn't like that you two are interacting and ignoring him. And exactly what he's saying is, I'm bored.
Yeah.
He's saying, bored, bored, bored. I'm bored. I want you guys to entertain me. Boxers are absolutely lovely dogs. They're one of my favourite breeds, but these guys are absolutely high energy.
We can throw a ball forever, come home, we tired, we'd want to sit down, have dinner or watch some TV, and it's just, what's next?
But we can't have that go on for 2 or 3 years. And it's not going to get better unless we address it. This is not something that Axel is going to outgrow. And that's one of the common misconceptions about this, is that they think, you know what, he's just a puppy. The reality is if we don't fix this now and we don't get on top of this now, he's going to end up at 2 or 3 with exactly the same problem, if not worse.
Look at you. Hey, Ellie. Come on, sweetie.
On the Gold Coast, Alex urgently wants to find out if 5-year-old Ellie has swallowed one of her owner's sewing needles.
Hey, little girl. Just a little sleep, okay? There we go. That's better.
Ellie has been vomiting and retching for 24 hours.
Not a lot of room down there. It does look a bit red on the roof of her mouth there. I'm just having a look down Ellie's throat at the moment, and it all looks pretty normal. Definitely no string under her tongue, no thread under there. Sometimes the thread can get caught under, but that all looks fine. It's not uncommon to see a bit of grass under there, but there's nothing there.
Ellie's owner Shirley is devoted to her precious little rescue cat.
She's a friend, somebody to talk to when you're by yourself. She meows and talks to me in her own way. She means a lot to me.
I might put that somewhere for safekeeping. The next thing now is to take her through to X-ray. If Ellie has swallowed any metal, like a needle or a pin, it'll show up as clear as day. I'm going to get you sorted out and get you home to your mum. But if it's stuck somewhere in her throat, it could cause major trauma.
We'll just get started and take bloods now.
Yeah, good idea.
In Sydney, Audrey is about to perform urgent surgery on 16-year-old Minnie to remove a potentially deadly tumour on her face.
It's a nasty looking lump. It actually looks quite aggressive. It's ulcerated on the outside. It's grown quite fast. So I'm quite worried. So it's really important to screen her internal organ function. I just want to make sure that's all good for anaesthetic and also that there's no spread anywhere. Good girl. A good girl you are.
Blood tests will determine whether elderly Minnie is fit enough for surgery.
Let's check those bloods, shall we? Yeah, let's take a look. Oh, that looks great, actually. So her kidney function's all within normal limits. Liver function all looks great. So if all looks good, we'll go ahead and do the X-ray. Check her chest, check her heart, make sure there's no spread there.
A little bit more.
X-rays will give a more definitive view of whether the tumour has spread to Minnie's internal organs.
Okay, X-rays.
Yeah.
So we're having a look at one view of the chest for any masses or anything unusual that might indicate a spread of a tumour into there. And it's looking nice and clear. So that's great news. It means we can go ahead with surgery. Time for your big procedure. Okay?
Here we go, sweetheart.
On the Gold Coast, Alex is X-raying rescue cat Ellie to find out if she swallowed something that could have caused a mysterious bout of dry retching.
We really want to get everything from right at the top back of her throat right down to her stomach, really.
Ellie's owner is afraid her little girl may have swallowed a sewing needle.
If Ellie has swallowed any metal, like a needle or a pin, it'll show up as clear as day. You ready? I can see a microchip there, and I'm really looking for something along here that looks like a needle in her throat. Yeah, that looks okay. That's good. That's good, Ellie. You haven't been eating any needles by the look of it. It's good news. There's no sign of any metal object either in her throat or in her stomach. It doesn't really explain why she's doing this retching. The mystery of Ellie continues, so I'm going to take her back out to the treatment room. Just get her back here. Good girl.
With a sewing needle ruled out, Alex is now starting to suspect another possible reason for Ellie's dry retching.
So we haven't found anything, and it makes me a little bit concerned about the possibility of a tick. Tick paralysis is really common in this part of the world, and if Ellie has got a paralysis tick there and we don't find it, then that could be fatal. That retching is a sign that her throat's becoming paralysed. The only way we're going to be sure that there's not a tick there is to clip all the hair off. It's just too risky.
Alex wants to make absolutely sure a deadly tick hasn't burrowed deep into Ellie's fur.
Oh, it's all coming off, Ellie. We've finished clipping all of Ellie's hair off. She looks like a very different cat. No tick, so that's good. So I reckon let's get her back to bed. Come on, beautiful girl. I'm relieved there's not a tick, but the mystery with Ellie continues. Hey? Are you waking up? I'm going to let her rest now and come back and check on her in the morning.
Good girl. All right, you ready for your anaesthetic?
In Sydney, Audrey is operating on 16-year-old Minnie to remove a suspected malignant tumour from her face.
All right, I've just put heaps of ointment in that.
Yeah, great.
It's an anxious time for Minnie's bedridden owner Andrew and his carer Charlize.
And it's a big day for Andrew because he's scared that her eye's going to be taken out. Very upsetting, but he's been reassured that she's in good hands.
She seems quite stable, so heart's good, breathing's good. I know how much Minnie means to her dad, Andrew, and how important it is that this goes successfully. So there's a bit of stress there, but I'm confident that we'll do a good job. So I'm clipping Minnie's hair away and I'm starting to get a little bit more concerned than I was previously, only because now I can see how big that lump really is. Right on the border of the eyelid margin. We don't want to obviously take away her eyelid, so it's a lot closer and a lot bigger than we thought initially, which means that we don't have a lot of skin to play with. Hopefully we get all those nasty cells out. I am quite worried that I can't take as much margins around the eyelid because it's really right by the eye. So we can only do the best we can and just take as much as we can to close up and then hope that we've got it all. So we've got that off. That's the big lump.
Let's send it to the lab. See what you are.
So the lump's off and now's the next big hurdle, which is trying to close up that defect, make sure that we've got enough skin to close without changing the eyelid shape.
Well, that's coming together nicely.
It is a bit like plastic surgery. I'm trying to just suture this closed without it lifting up her eyelid. As much as it is about getting this lump off and finding out what it is, it's really important to me, and I guess the owner as well, that we return the cat looking as much as we can normal. It's already quite a big surgery. There's going to be stitches in its face. So I just want Minnie to look as good as possible. Okay.
All done?
Yeah, done.
Let's see how that eye is looking.
All right, there's obviously a bit of swelling. So once that swelling goes down, I'm hoping that that eyelid will actually sit pretty well. I didn't have to push it up too much, and I actually managed to drag some skin from further up in her head down. So I think that will heal really well. And I guess the big test is in about 10 or 14 days when we take the stitches out, how it looks. But pretty happy.
It will be an anxious wait for the test results to find out if there are any cancerous cells in the sample.
Removing the lump is one part of it. Whether those cells have started to go into the body or seed into the bloodstream, we'll never really know, but it looks like we probably got it in time.
Okay. Ready to go home?
His name is Buster.
What's going on with Buster?
So they've reported that he's struggling to breathe.
At the emergency hospital, elderly Buster has been rushed into Gerardo.
Oh, I can hear it.
Yeah.
He's having difficulty here. Can you hear that?
Yeah.
Yeah. Anytime a dog is brought down to us and presents with breathing like this, my number one concern is upper airway obstruction.
This is not good. His airways are closing over. It sounds terrible. His breaths are like... Okay, we need some sedation. That will reduce his stress. Can you give him some oxygen, please? Here we go. Sure. I'll give you a mask.
The causes of upper airway obstruction could be anything from foreign body, like something stuck in the back of the throat, to swelling potentially caused by cancer, or even paralysis of the upper airways. It can be caused by a deadly paralysis tick.
We have to give him some sedation quick because his airways kind of closed over, and the sedation will settle down his breathing and make it easier for him to breathe through his closed airways. Okay, here we go, mate.
Good boy, brave boy.
Oh, you're a superstar. Okay, there we go. Is he chilling out?
Yeah.
Oh, that's much better. The sedation's kicked in and we've bought ourselves a bit of time. Now we can have a look to see what could be causing the airway narrowing. Okay, I'm gonna have a squeeze down his mouth. Good boy, Buster. There's nothing down the back there. It's like as if he's got paralysis of his upper airways, so let's check him over for a tick.
The deadly venom from the paralysis tick can rapidly result in an animal being unable to breathe.
I don't think he has a tick. I don't think he has swelling that could close his airways. So my concern then is that he's got Yeah, like laryngeal paralysis or something like that. What I'm concerned about now is something called laryngeal paralysis. This is common in older dogs, and it's where their upper airways start to collapse in when they breathe in. This can be life-threatening, as it can result in them being unable to breathe.
Oh boy.
If this goes on for 2 or 3 years, you guys are going to get kicked out of the apartment building.
Oh, for sure.
Yeah.
In Sydney, it's time for Kate to reveal her solution to stop young boxer Axel's constant barking.
I'll wait for you. Show us how you can do a good sit. Excellent behaviour. Yes. Boxers are high energy. They need lots of walking, lots of activity, but they also need a lot of mental stimulation. We've got to teach him how to play by himself without relying on you guys. So there's heaps of puzzle games for dogs. We've got a little activity ball, right, which we load with treats, and then he has to actually figure out how to actually get the treats out.
Oh, nice.
There you go. Try that. He's going to spend hours playing with this rather than annoying you guys.
Oh, you got it.
These little brain activities and these little puzzles are twofold. So not only are they keeping him entertained, so these guys can sit on the couch and not have him in their faces, but it's also meaning that he's getting tired by using his brain.
What's in there?
Oh. What I want you to do is put all of his regular food in one of these instead of him getting dinner.
He is so focused on that toy. His paws are working. You can actually like almost smell his brain working.
So the final part of this is rewarding calm behaviour. Perfect. It's exactly where he's supposed to be. This is the perfect behaviour. This is what we're trying to get him to do. We want him to get to a point that he can relax on his own. It looks like it's a treat for nothing, but it's not. It's reinforcing just that he needs to be calm, allowing him to teach himself how to self-soothe.
Amazing.
Perfect box of behaviour. This is the way that people should engage with their dogs all the time.
He's not barking.
It's not barking.
So beautiful.
Wow.
Yeah, you can do it.
You're a good boy. Yes, you are.
There we go. Good boy, Buster. Good boy. A couple quick x-rays and a little look down your mouth, eh?
At the emergency hospital, Gerardo is starting to suspect elderly Buster has a condition called laryngeal paralysis, which is severely affecting his breathing.
Let's see. This is the x-ray of his neck, where that noise is coming from.
He's hoping an x-ray will provide more clues.
This is his larynx.
Oh, yeah. I can see what you're talking about just here.
Around there as well.
Yep. I think it's probably... How old is he?
But 13 years old.
Okay, so he's an old boy. I think it's probably associated with his age, just calcification.
I think the next step is have a look down.
Yeah, see how his larynx is moving.
Yeah, that's
good
right.
plan. You're a lovely old boy, aren't you?
Well, he's a sweet soul.
All right, Buster, just a little sleep, okay? I'm just going to give you a little bit of twilight anaesthetic.
Okay, let's have a look. What we're going to do now with Buster, we're going to give him a drug which makes him breathe in deep, and we're going to have a look at his larynx. So what we should see is when he breathes in with a big deep breath, those doorways down there, those airways should open up. Wow, they're getting sucked closed.
Yeah, they're just not even hardly moving at all, are they?
Yeah. From what I can see down his airways, it confirms my suspicion that he has laryngeal paralysis.
Oh, good boy, Buster.
Good boy.
Yeah.
Okay, let's let him wake up with that.
He should be able to breathe a bit easier now.
There we go. The larynx is a set of doors which protect the airways. So when you breathe in, the doorways open and let air down into the windpipe. But when you swallow, what happens is those doorways close and then food goes over the top down the esophagus. If he gets too stressed out or even excited, he'll start to breathe faster and spiral down into respiratory distress. Okay, pull the tube out time now. Good boy, good boy. Okay, let's see how he breathes. Okay.
Unfortunately, with Buster's condition, there is only a limited number of ways that we can help him. Good boy. We're going to give him some anti-inflammatories which will reduce the swelling at the back and start him on those medications which will keep him nice and calm at home. Home in the morning, your family will be very happy to see you. Good boy, Buster.
Hello, you awake? Oh, you're looking very bright.
Next day on the Gold Coast, Alex has some early morning good news.
I hear you've eaten a whole bowl of food overnight.
When I see Ellie this morning, she looks great. She's had no more retching, and I think she's ready to go home.
You do look a bit different. What's your mum going to say?
Despite x-rays, a thorough physical examination and shaving her for ticks, the reason for the 5-year-old's sudden dry retching is still a mystery.
Hop in, good girl. There you go. Okay, let's go and take you to your mum.
Although we don't know what caused Ellie's retching, I think Shirley is going to be very happy to see her. I know how much this cat means to her.
Now, do you recognise your Ellie in there?
Oh my goodness, darling, what have they done to you?
Yeah, even her collar looks a bit big now.
Is it darling?
It'll grow back. Pop in, good girl. She's still a bit of a mystery, but I think let's get her home.
Yes.
See how she goes, and hopefully, no more problems.
No.
You good boy, Shane? Good boy, Shane.
In Melbourne, Rosie's waiting for Dr. Danny to arrive to help sort out her big boy Shane.
Drop. Good boy. Shane is a gorgeous, loving, cuddly puppy dog.
Good boy. Ready? Good boy.
But fun-loving 2-year-old Shane has an embarrassing problem.
Oh, you're a stinky boy. He's got a bit of a scent, plus this sort of oily, grimy skin.
Let's hope Dr. Danny sorts you out.
Here we are.
What a beautiful boy.
Other people are starting to notice, which is a bit embarrassing. I just feel bad for Shane because he's so loving. He wants to give them a cuddle and they don't want him anywhere near them. So we need to sort this problem out.
Hello, Rosie.
Hi, Danny. How are you going?
Hi, good. Hi, Shane. Hiya, Papa. Oh, my goodness. I walk in to meet Rosie and Shane today, and straight away it's a bit stinky.
We love Shane. He's a gorgeous, loving and very cuddly dog.
Oh, yes.
But he smells.
Oh, dear. Okay.
And I just can't take him anywhere.
And have you noticed anything else strange about his coat?
Look, if you touch it, it's quite oily.
The Bulldog Mastiff cross has another problem that doesn't help when you've got bad body odour.
He seems to have developed a little bit of a fear of the water.
Okay.
So it is quite a challenge to lure him in and then hoist him up and get him into that bathtub.
I bet.
He used to be good at having a bath when he was a puppy, but now he seems a bit scared. We try to bathe Shane as often as we can, but getting him into a bathtub is very, very challenging.
All right, Shane, let's have a little look at your skin, mate. Hey? Oh, yes, I can feel all that grease. Oh dear. Oh dear, Shane, you are a smelly boy. Hey? In the groin as well, and in the armpits. This is definitely abnormal. What I think is going on with Shane is that he has a condition called seborrhea. I can see the sebum actually on my hands, so we definitely have a problem there today. In Shane's case, he's not actually dirty. He's got an overproduction of sebum that's causing all of that oily skin and the smell. So we've just got to get that under control. The good news is I do have something here today that I think is going to help a lot.
Okay.
Now it does involve having a bath though. How do you feel about that?
I'm game with your game, Danny.
Let's give it a crack. Shane is a big boy and I hear he doesn't like baths, so this might be tricky getting him into one today. Oh, darling. Hey.
Have a look at this, hey?
At the emergency hospital.
Talk about metal. Look at that. how sharp that looks.
It's a bizarre case of deja vu for Alex and Gerardo.
I can't believe this. Is that the hole?
Yeah, that's the eye of the needle. It's actually a sewing needle.
This is the second pet which has come down for playing with a needle.
If he's swallowed that, that could even have moved out of the esophagus and be sitting in his muscle tissue.
That needle could puncture something vital or cause a lot of trauma to his airway. Anything that interferes with the dog's ability to breathe is life-threatening.
Here we go. Here's the boy. He's arrived. His name's Ralph.
Hey, Ralph.
He's a bit worried. Good boy. Good boy.
The anxious dog has been struggling to swallow and hasn't eaten anything in 3 days.
So it's up in his neck.
Yeah, it's just so hard to see exactly where it is, isn't it?
And they can be so hard to find.
All right, matey, let's get you through.
From my previous experience with these things, they can be super tricky. There's only two options. One, we're able to go in there and find the needle and remove it, which is ideal and what we hope for. Or two, we have to go and surgically explore, but we don't want to do that because there are so many vital structures there.
Hey mate, hello. It's okay.
That's it. Good boy. Off to sleep. And hopefully when you wake up...
You don't have to worry about that thing in your throat anymore.
Right, good boy.
With Ralph now sedated, Alex and Gerardo can take a close look down his throat.
9 tube. Yep.
Thank you. Yeah, maybe because I've just got to have a look. Yeah.
Oh, there's a string there. See that string?
Ralph has done us a huge favour.
Yeah,
At least he's swallowed a needle with some thread attached, because we may be able to pull on that and get the needle out.
I think we should make sure we get hold of the string so we don't lose it.
Okay.
Before we start.
That's good thinking. Oxygen on?
Yep. Oh, now. That tube's not going to make anything easy. Oh, let me hold the tongue.
It looks like it's coming out of went through the top of the roof of his mouth.
Oof, don't lose that string.
We're all holding our breath now. The thread is soft and very delicate, and we're hoping that it doesn't break.
Okay, just be so careful.
You got it?
Yeah, great.
Yeah.
Thank you.
Ooh, it's coming.
Yep. Keep pulling, just gently. Just don't want to snap that piece of thread.
Whoa.
Ooh, you just don't want him swallowing.
Okay, Shane, you coming? Come on, are you going to be good for Danny? Come on, Shane.
In Melbourne, 2-year-old Shane badly needs a bath to treat a skin disorder that makes him unbearably smelly.
Shane, it's bath time.
But Danny and Shane's owner Rosie have a big problem.
He just doesn't like getting in the bath. He's 55 kilos at 2 years old. He's quite difficult to wrangle into a bathtub. So I don't think Danny knows what she's in for.
So I'm going to suggest that we use this little trick, and it's smearing this delicious peanut butter.
Shane looks excited.
To lure you in. Good old smear. Let's see if this works. Come on, Jane. In you come. It's working. The peanut butter worked. I'm thrilled. He actually just walked himself into the bath today. It's fantastic. Now we're halfway there, mate. You're doing so well. Let's see if we can just assist you in the back. Good boy. Yummy. Look, it's some yummy peanut butter. Oh, yeah, good boy. All right, let's get into it.
Oh, I can't believe it. When Shane first goes into the bath, he goes in easily. Danny proved me wrong. A little bit of peanut butter, apparently that's all he needs.
All right, mate. Just gonna let you down. That's a boy. Good job.
He's being so good.
We don't need a bath, Shane, but thank you.
Danny can now begin treating Shane for his unpleasant odour.
So I recommend we use the medicated shampoo, and it's going to help resolve all of that seborrhea as well as sort out any surface infection that's going on, so bacteria, yeast, that sort of thing. So we need to lather this up in all the problem areas.
I think he's liking his massage.
I think so. Does that feel nice?
a bit of a workout giving.
I know. It is. So you want to do this shampooing twice a week for 3 weeks and then continue to use it weekly ongoing to keep that seborrhea and surface infection under control.
I think Shane is loving his bath. Who wouldn't want a full body massage on a beautiful summer's day?
Bath time fun, hey?
The 5-minute lather is up.
So lovely and fresh, hey?
Time for a quick rinse.
Oh, no, not yet, not yet. Hang on a minute, hang on. Get under your neck. Such a pamper session for you, hey? Stage 1 has been successful, now for stage 2.
And finally, some conditioner.
Just dab it everywhere and lather it in like it's a moisturiser. And then that's just left in to dry. And that'll keep all the moisture in the skin and be a bit of an extra barrier to allergens and things like that as well. After just that one bath today, Shane is smelling beautiful and his skin feels fantastic. I'm sure he is feeling a lot better too. Oh, I think you're going to be a bit of a hit with the ladies at the park now, mate, hey?
Oh no, he's getting dirty
Oh,
again.
mate, out of the garden.
Looks like it's coming out of the top of the roof of his mouth.
Oof, don't lose that string.
Whoa.
At the emergency hospital, Alex and Gerardo are trying to carefully remove a needle and thread that's lodged deep in Ralph's throat.
Okay. Oh, it's coming. There's a heap of tension on it now. It's slowly coming.
Just pull gently. Oh, yep, I can see it coming through there.
Oh.
Oh my God.
Suddenly, the string comes away and there's no needle. We've lost this.
Is it down the back of the throat?
Oh my gosh, this is so lucky.
Then I see by some miracle, the needle is in the back of Ralph's mouth.
Oh, how lucky is that?
The thread undid as we were pulling it through.
But it brought it right to
But
the
it
edge.
brought it right to the edge.
Ralphie, you're such a lucky dog. This means there's no surgery for you.
And that's been there for 3 days.
Imagine it slowly digging its way to the back of the throat.
Yeah, it's a bit traumatised. And I think he's probably going to need some antibiotics and some more pain relief for the next few days, but that is amazing. You may as well have a pedicure while you're at it, Ralph.
I haven't trimmed nails in ages.
Things could not have gone any better.
But now Alex and Gerardo want to do an X-ray to make absolutely sure Ralph hasn't swallowed anything else he shouldn't have.
X-ray. How'd we go?
Really good. It's gone. There's nothing there now, so we got it.
Good job. He was so lucky that string was there.
I know. I just think he's unlucky, but he's lucky at the same time. So, but I just don't know what made him swallow a needle and thread.
2 hours later.
Hey, little Ralphie. You look all bright and happy. Now's the time for the final test. See if you're eating okay. Can you eat the chicken? Will you like the chicken? You want the chicken? Or you eat the chickens? Your first meal for a couple of days, hey? Is that good? Is that good? Is that good? Hey? Now let's get you home, hey?
Pets and needles and 2 on the same day. This would have to be some kind of record.
This way.
How's our mini girl going?
She's doing really well.
Yeah, she's been good with healing, leaving those stitches alone for us.
She has, yeah.
In Sydney, Audrey has come to check on Minnie the cat a fortnight after removing a cancerous lump from her face.
All right, let's have a look at how it's healing.
It's looking pretty good. Good girl, Minnie.
Oh, I like how that's healing. That hair's growing back already as well. I'm pretty happy with the work we've done. I'm just glad we got everything together and the eye looks pretty good.
I was worried about her eye opening and closing, but she seems to manage.
Yeah.
It opens and closes well. And
Yeah, and certainly, you know, that might relax a little bit once we take the stitches out as well. But I'm quite happy with how it's healed.
It's perfectly healing. It looks really good.
I know Minnie's so important to Andrew. Has he been missing her a lot?
He has.
Yeah.
He has.
Now, those results from the histopathology lab have come back. It has come back as a nasty one, so what we call a squamous cell carcinoma.
The biopsy results confirm Minnie's ugly lump was indeed cancer.
The good news is, even though we didn't have that much skin to play with and it was really close to the eyelid margin, we actually got it all. Generally, if we get it all and her lymph nodes are okay and the rest of her bloods are okay, there's probably no spread, so we got it just in time.
You hear that, Minnie?
Yeah, very lucky girl.
Yes.
So when you look at Minnie, I think everybody's pretty happy with how she looks now. That nasty lump has gone from her head, and it's actually healed very well. There's always a chance that a nasty tumour can regrow, so fingers crossed it never comes back again.
All right, let's take those stitches out.
Good girl, Minnie.
All right, baby girl.
Once the stitches are out, Minnie can return to owner Andrew's bedside.
Nearly finished, Minnie. Really done. That is so good.
Ta-da!
Oh, brilliant. Look at that. Andrew will be happy to see her. He's missed her. Now they can get back to their normal life. Really appreciate it.
Of course, anytime.
And Andrew will be very happy to have Minnie back.
Bye, Minnie. Bye, Charlize.
Thank you, Audrey. Thank you so much. Bye.
Come down. Look what I've got for you. Isn't that fun?
Several weeks after Kate's visit, Axel's constant barking has almost stopped.
Yum.
Food puzzles are helping to relieve Axel's boredom, and owner Jess couldn't be happier.
We are challenging him every day, and we are watching TV in peace and quiet every night. So Dr. Kate knows her stuff.
And it's good news for big, lovable Shane. Owner Rosie has been managing to keep up with his regular medicated baths, and his smelly skin condition has cleared up.
We can take him to the park. Everybody loves a cuddle with him. It's been amazing, the change.